What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm great. Hi, everybody. Thanks again for listening to us. Today, we're going to talk about Bell's palsy. It's a pretty common occurrence out there. In conventional medicine, it pretty much is known to have an idiopathic cause. We really don't know what causes it, but hopefully with this podcast, you'll get an idea of what's actually going on with it.
Yeah, in
Anyway, to get
general, people
started,
probably hear about it first from celebrities suffering from it.
yeah,
People
right.
may know the name, but may not necessarily know exactly the outcome or what it is.
Right. I mean, typically the presenting symptoms are, usually one side of the face is drooping, and it can come on all of a sudden, no rhyme or reason at all, right? So people can wake up from sleep and all of a sudden they go look in the mirror and they see that their face is drooping. So they have a droopy lip to one side, their eye is kind of drooping a little bit, or they have paralysis on, just paralysis on one side of the face. Maybe they can't shut their eye all the way,
Mm-hmm.
that type of thing. And it can be
Mm-hmm.
pretty scary, right? You get up and you see your face drooping. One of the things you may think about is stroke. And this is one of the
Right.
things that me and you, if somebody presented with us, we would want to rule that out first, right?
Right. Right.
Just to see. And it's not always easy to rule that out because the symptoms of Bell's palsy are very similar to stroke. But as healthcare providers, for us, it's somewhat easy. But um, if you're getting numbness and tingling in the face, you're getting droopiness in the face, you can't shut an eye, you're slurring your speech, you're drooling because you can't control one side of your face. A lot of times that looks just like a stroke
Mm-hmm.
type
Yeah.
symptom.
Yeah, but to your point, for
And
just general differential
and
diagnosis, obviously those are going to be your only symptoms, right? Like you're not going to have that, scapular pain or something else to go along with this very specific nerve. Can you hear me, Keoni?
right, so you're not going to have, right. So other things that you think about with stroke is, you're not going to have difficulty walking, and
Right.
you're not going to have difficulty, with muscular weakness. Did I just lose you? Are we
Uh,
okay?
we're okay.
Okay. All right. So anyway, what I was saying is you may have difficulty walking. You also may have like one-sided weakness, where you wouldn't have that with Bell's palsy, right? You're not gonna have
Right.
difficulty walking, or like arm weakness or leg weakness, or staggering. But some of the other things like migraine, weird sensations, the drooping face, numbness, tingling, headaches, that type of thing, you can have that. Anyway, so you want to rule out stroke first. That's the very first thing. If you wake up, or all of a sudden get Bell's palsy.
Absolutely.
Usually both, if you catch it early enough, can dissipate quickly. But for some people, it can last a while, especially if you don't catch it early enough. Bell's palsy and stroke. But rule out stroke. You want to take that. If it is stroke, you want to take care of that right away. This is why you want to see a healthcare provider right away to make sure it's not that. And hopefully it is Bell's palsy, because usually Bell's palsy, with or without treatment, will resolve on its own. However, with treatment, it resolves much quicker. And without treatment, it can last a very, very long time.
Yeah, and to add
And
to your point, Keoni, just in terms of the net, like having a urgency, having some like necessary speed about it. I was reading through some physical therapy stuff about Bell's palsy, and I just found that so in general, corticosteroid injections have helped. And then they showed in this study that if it's within 72 hours, it's a much significant improvement compared to if you had waited after 72 hours. So it just goes and speaks to, if you're having these symptoms, you definitely want to go get them checked out. And obviously, if it's not a heart attack, would be a great thing, but you can also get treatment for the Bell's palsy quicker, and hopefully it'll be more effective.
yeah. And the fact that, as you bring up, that corticosteroids may help, it says something about inflammation or swelling, compression of the nerve, is causing a problem. And that nerve that we're specifically talking about is cranial nerve number 7, it's a facial nerve. It comes out, spreads up into the forehead, into the face, around the eye, and into lower jaw. So you can see the whole left side is kind of drooping. Now, we're talking about unilateral side, but there are cases of Bell's palsy where you can have both sides. They're rare, like less than 1% of the cases, but typically it's one side. Those are the typical things. So if we're thinking about nerves and nerve compression, nerve swelling, think about that cranial nerve number 7. I mean, if you remember back to your med school days, right? It's like going through these canals and everything in your face, bony canals, and it can swell and cause compression. The other thing that is really interesting about Bell's palsy is there seems to be some sort of correlation with viral infections, specifically HSV1, herpes 1 virus, and then also varicella, chickenpox virus, which is another or zoster virus, and that herpes zoster, and that is another virus that seems to be related to it. And if you think about these two viruses, they seem to like to hang out in the nerves, right?
Right.
And when you're under stress, when you're immune compromised, or if you didn't get enough sleep, let's say you have some bunch of comorbidities like heart disease, diabetes, all these increase your risk of Bell's palsy, by the way. You're sedentary, increase your risk. Smoking increases your risk. All the things we talk about, the comorbidities, chronic disease can increase your risk of it. What's really also interesting is there's also some correlation with other viruses, including COVID. So there's
Keoni, can you hear me?
slight increased risk if you've had, and the other, your chickenpox vaccine, you tend not to. Yeah, I can hear you. I lost you, Brian.
Yeah, we're just super delayed. I got the gist of what you're saying. It was just very cut up. So you were alluding to, like, obviously viruses can possibly, or viruses play an impact in Bell's palsy, and you were getting all I heard is like cutting in and out, and I just heard COVID.
Yeah. Okay.
So catch us back up to speed.
Yeah. Sorry about that, guys. Our connection is unstable, but hopefully we can get through. So let me just reiterate that there are specific viruses that seem to have a strong correlation with the occurrence of Bell's palsy. One being HSV1, which is the oral herpes virus, and 2 being herpes zoster, which is the chickenpox virus. All right. But other viruses also seem to be correlated with it. And one of those would be COVID, right? So there's a slight increased risk of Bell's palsy with COVID infections. Right. And it speaks to the fact that these viruses kind of, they may be there, but your immune system may be compromised from them, or may be waging a chronic constant battle, certainly like they do with HSV1 and chickenpox virus, herpes zoster. I mean, once you get these viruses, they don't go away. So when you're immune compromised, they come back. I don't know. Have you ever had a cold sore, around your lip? Anyway, that's HSV1. I certainly have. And a lot of times, the older you get, the less they occur for a lot of people, thankfully. But if you are immune compromised, they will come out. One thing, this is just a plug for the chickenpox virus vaccine. If you get the vaccine, guess what? You're highly unlikely to get Bell's palsy. And there's another disease that's kind of related to Bell's palsy, looks just like Bell's palsy, and in fact, a celebrity just had it. It's called Ramsay-Hunt syndrome, and it's Justin Bieber who just had it. It looks like Bell's palsy, exactly, and it really is Bell's palsy, but it is known that it is caused, in this syndrome, it's known that it's caused by the chickenpox virus. All right. And it's a little bit different than Bell's palsy because you tend to have like a skin rash, especially like an external ear rash, but it looks just like Bell's palsy. It's more severe though, so it lasts longer. It tends to be more painful, more uncomfortable. Again, sometimes it will it tends to resolve on its own. But a small percentage of these cases don't resolve on their own and can take months to years, and a very small percentage may not resolve. So that's why you want to take care of it as soon as you can.
Is Beebs okay?
I haven't heard. I think he's doing fine now. I hope so.
All right. No news is good news on the beaver.
Yes, that's right. But speaking of viruses, right? Part of the conventional treatment would be using like antiviral drugs. It's interesting though, because some of these antiviral drugs like Valtrex or acyclovir studies seem to help, and other studies they seem not to help. I use antiviral herbs because there's not that much of a it doesn't seem that these drugs help significantly. The antiviral herbs also have less side effects, and also some of these antiviral herbs, we're going to talk about one of them specifically, which is licorice root extract. It's very strong antiviral activity, and you can actually dab that extract on like lesions like herpes, cold sore viruses, and it usually really helps take it away in no time at all.
Hmm.
But so we think there's a viral component to it, so antivirals play a role, either natural or conventional. We also know that people tend to get this from being immune compromised, so any like techniques to reduce stress, getting more sleep, all of this stuff can help prevent, but also can help you recover from it. Inflammation plays a role. That kind of speaks to some of the nutraceuticals or some of the drugs you may want to use. You spoke of one, corticosteroids, right? It can help quell inflammation. That is the one of the bugs that I do want to talk about is not necessarily bacteria, and I do want to bring this up because, or not necessarily viruses, it's a bacteria, and it's the bacteria that causes Lyme disease, because there are Lyme disease presentations that look just like Bell's palsy. So it's good to rule Lyme disease, and that bug is Borrelia burgdorferi, and that bug tends to cause like a facial palsy that can be mistaken for Bell's palsy, and it's typically. What's really interesting about it is, typically in children, you tend not to see Bell's palsy in children as much as you do with adults. But when a child has it, you may want to start thinking about Lyme disease and treating that.
Mhm.
And if we're talking about a bacteria, then the treatment would be like an antibiotic. And of course, some of the other stuff that we would talk about would help too. So I bring that up because a lot of people may miss that, and that is something that you really want to think about, especially if you live in an area that's endemic to Lyme disease. Like North Carolina is one of them, and a lot of the southeastern, even up into more of the northeastern states.
Right.
So what are other things besides infection, like the viral infections we talked about, that seem to have associations with Bell's palsy? Anyway, any type of infection we can actually say does have some sort of association. Anything that will decrease your immune system can have some sort of impact on Bell's palsy. All right, where it can increase the frequency. Pregnancy increases the risk of Bell's palsy. Again, this lots of changes going on in pregnancy. There can be nerve compression. There can be a whole lot of other things, but pregnancy is one. We talk about ruling out stroke, but stroke in itself can increase the risk of Bell's palsy also. So it seems stroke victims can have more of a frequency of Bell's palsy. Anxiety is a big one also. Stress, think about stress lowering your immune system. In one study, anxiety patients are found to have 50% increase in risk of developing Bell's palsy. That's pretty big.
Yeah.
Diabetes is another one, increases your risk. Hypertension, and of course obesity. And all of these, not only are they associated with Bell's palsy, but they are also associated with poor recovery rates. So the healthier you are, the quicker you'll recover. Migraine sufferers have slightly increased risk, and then cancer also slightly increased risk of that
Hmm.
also. Um, so it's like, taking care of yourself, less likely to get Bell's palsy. Um, let's see. I want to just talk about, again, reiterate like what are kind of the typical symptoms of this. We talked about being unilaterally one side. There's facial weakness. It tends to worsen with the first few days and then tends to get better. You get drooping of one side of the face typically, although you can have two. A lot of times one of the bigs that I try to help my patients with is they can't a lot of them cannot shut their eye because of the Bell's palsy. And so what that can lead to is a dryness of the eye. So you want to use like eye drops or like eye gels at night to keep the eye moist. Um, and then this is kind of counterintuitive, but also because of the Bell's palsy symptoms, you can have excessive tear production. But again, since you can't shut your eye, it doesn't moisten the eye. It's just dripping over your face. And so that's one big thing that you want to do. Some of my patients I'll recommend when they really at the beginning can't shut their eyes to like wear an eye patch to help keep it shut and to keep it uh, moistened.
Yeah, some form of
Um,
protection for sure.
yeah, yeah. You can get ringing in the ear, you can get different changes in taste, hearing sensations. Of course, if one side of your face is drooping, you can have difficulty eating, drinking, speaking, and of course, difficulty smiling. And as you said at the very beginning, as soon as you get symptoms, you want to talk to a physician for, again, ruling out stroke, but also getting treatment right away, both for stroke and Bell's palsy. The sooner you treat it, the better.
Right.
And um, so the diagnosis really is tends to be clinical, but you certainly can do additional testing that can, kind of help. I've rule out or rule in other things that may mimic Bell's palsy, and that's just like a regular um, chemistry panel, CBC, check doing tests for testing for inflammation like sedimentation rate or C-reactive protein, doing a Lyme titer, doing a varicella zoster, chickenpox antibody test, checking kidney function. All these things can tell us something. Cerebral spinal fluid tests are sometimes recommended to identify, specific types of diseases, shingles, Lyme disease, other viral infections. Um, there is a grading system for Bell's palsy. I won't really get into that. I've never really used them before for my patients. I usually get referrals to do acupuncture, which is a great treatment for Bell's palsy. But you certainly can if you get a grade from, it's usually from 0 to 100. They have different grading systems but it's usually from 0 to 100. The higher the grade, the more severe the symptoms are, the more likely it's going to take, the longer it's going to take to recover, the higher the score on that grading system. So we talked about treatment, corticosteroids, antivirals. We want to maintain the eye health, right, by protecting the eye that's being affected by it. There are some pretty neat treatments that I have started recommending for my patients that can really help. One of them is like the cold laser treatment. There are some studies that show that it can help. I don't know if do you use those in your practice, any of the cold laser stuff?
I don't currently use any
No?
of the cold
Yeah.
laser stuff. PT certainly
A-
can, but I have not. Yeah.
Anyway, there's some studies. They're not definitive. It's a very non-invasive treatment. I have a cold laser that I've been using with some of my patients, and it does seem to help. The treatment with using a cold laser is usually 10 to 15 minutes, and you're just placing the laser along the face where it's drooping in certain points. I usually do certain acupuncture points, and there's no risk of negative side effects or anything like that. So that's one thing I recommend that a lot of people really don't know about. Another thing that I'll refer my patients to is hyperbaric oxygen therapy, especially if they're not getting better. But there's some interesting studies on hyperbaric oxygen therapy that are pretty astounding. Just a few sessions, people can get pretty good results from that. Actually, I was in the hyperbaric oxygen chamber today, and it feels
Nice.
great. I just do it for recovery, workout recovery, and stuff like that. But what does it do? It saturates your body with oxygen. It helps increase blood flow. So doing any of that is going to have some sort of benefit on the
Hmm.
body. And usually you're in there for like an hour, and it's a very relaxing treatment. It's cheap. Sometimes insurance will cover it. I paid out of pocket today $57 to just have a nice nap for an hour and read and feel better. I feel really good after doing that. Um, there are other therapies that you can do like infusions. These are more conventional treatments for like steroids and things like dextrin and pentaphyline. Using these drug combinations seem to help. The steroids help reduce inflammation, and the combination of dextrin and the pentaphyline just increases blood flow to the nerve. So sometimes that infusion will work. None of these are definitive. It's certainly not the first thing I would try, but it does. These are things that people can try, especially if they are in that small percentage of people that are not getting results. Getting better with the Bell's palsy right away. Um, there's another treatment using nerve growth factor stuff. There's some studies in China that show that it really helps, and it's just basically is intramuscular injections of like this nerve growth factor that just helps the nerves regenerate better and helps decrease the healing time with the Bell's palsy. So let's go to more of the stuff that I do for it. One of the things that I think this speaks to the viral component of it, specifically the HSV1 part of it, is getting people on a low arginine, high lysine diet. So you've probably heard people taking like lysine supplements if they get like oral herpes outbreaks. The reason behind that is because these viruses increase their replication with arginine high foods. And a lot of these arginine high foods are the foods that I just love, like peanuts, tree nuts, definitely chocolate, very high in arginine. Whereas lysine inhibits replication. So that's why, and these are amino acids, and taking a lysine supplement can suppress the herpes virus replication. So sometimes manipulating diet can help with that. And as you guys probably guessed, one of the main things I use for treating Bell's palsy is acupuncture. And there's really some neat studies on that. Typically, I just treat with needles. I'll treat along the face with needles and do stimulation there. And I'll do it either manual stimulation or even better electrostimulation, where I just put electrodes on the needles and try to get the muscles contracting a little bit and increasing blood flow in there, and it really helps. The Chinese diagnosis for Bell's palsy is called external wind cold, right? That's the diagnosis for it. And so, of course, the Chinese back in the day certainly did not know, in ancient China, did not know anything about viruses or anything like that. But what they did find was when people were exposed to cold for prolonged periods of time, what does it do? It depresses your immune system. And a lot of these people would have Bell's palsy. It's interesting. I've had a couple people with Bell's palsy, and one was outside on a very cold, windy day. The next day, woke up with Bell's palsy. Another guy was riding his motorcycle on a cold day and got Bell's palsy. So
Wow.
it kind of fits. It kind of fits that Chinese diagnosis, which I found very interesting. So in Chinese medicine, it's very elegant and simple, right? If you have a cold pathogen, that's what they'd call it. We call it like like I don't know, HSV1 that's causing it. But if you have a cold pathogen in Chinese terminology, then one of the things you'll use is heat therapy on the face. So a lot of times I'll recommend people use some sort of heat, either heated cloth. I use like a heat lamp, like an infrared lamp. Sometimes I use moxibustion, which is another form of heat, to also treat um, Bell's palsy. The cold laser also adds a form of heat to the body, increases metabolism to the body. Even though it's called a cold laser, it's kind of counterintuitive. Cold laser just means it's not a hot laser. The hot laser meaning that it will cut you, right? The hot laser, so that's why they call it a cold laser. This one does not cut into the skin. So acupuncture is a great treatment. I usually recommend, I tell people, like, if we catch it early, usually 3 treatments will take care of it. You'll start notice improvement right away with acupuncture.
Yeah, that's interesting. So generally you're going into the muscle is your goal, right, Keoni? Because at first the acupuncture doesn't make sense to me how it would help causing more inflammation. But then when you speak about, facilitating some of these muscular contractions with the electro acupuncture, that definitely makes sense to me.
Uh-huh. Yes, yes.
So you're primarily trying to get into the muscles when you do this treatment?
To a certain extent, a lot of the acupuncture points will stimulate the muscle contraction there. Whether you do it by manual stimulation or electrostimulation. I like the electro because I don't have to sit there and stimulate them manually. So you can depolarize and cause the muscles to twitch a little bit with the needles. But yeah, the electrostimulation is great. And I think clinically, I see it better than the manual acupuncture doing that. It seems to work better.
Yeah, that makes sense.
Yeah. And then, speaking to your expertise, physical therapy, right? I mean, just as simple as massage, exercises for the face, anything like that. That also, there are some studies, they're not definitive, but there are some studies that show that certainly can help. And it makes sense. Like anytime you're moving the facial muscles, you're increasing blood flow, oxygen flow. You seem to have a better outcome. And Bell's palsy patients recover their muscle function a lot better with certain forms of physical therapy and exercises. And you can look some of this stuff up online as far as facial exercises for Bell's palsy. So I'll recommend people do that. There are other things out there that can certainly help. Biofeedback is one that can help. Any form of stress reduction will certainly help also. So what about nutrients? One of the things that people, I think most of the lay public know when they even come in to see me and they've been diagnosed with Bell's palsy is they know right away to get on B vitamins, specifically vitamin B12. There's some pretty good studies on B12 decreasing the healing time. The studies are usually done with B12 and some form of steroid done together, and it decreases the healing time. So even conventionally, doctors will use both of those. The studies are mostly on intramuscular injections, although I will, if they haven't done that, I mean, I'll either refer out or I'll just get them on a good high potency multi and or a B complex vitamin orally. And I see that it helps just as well as the injections. But definitely, I think we have pretty good study on B vitamin, especially B12, helping with that. Acetyl-L-carnitine. This is a compound that's found throughout the central and peripheral nervous systems. It's a natural substance. It helps process fatty acids. There are some pretty neat studies on it with patients with facial palsies like Bell's palsy, given 3 grams of acetyl-L-carnitine. Again, some of these studies were done in addition to with steroids, but compared to the control groups, these people that had the acetyl-L-carnitine recovered much quicker. So this will be a lot of times part of my protocol for people who, they have Bell's palsy and they want to get rid of it. I mean, because that's what you're showing the world. So a lot of people are really insecure and self-conscious because they're half their face is drooping and they're really worried about that, as they should be. There's other additional support nutrients that I use, omega-3 fatty acids. These things help with nerve regeneration and also reduce inflammation in the body. They are really, really nice preventives to help. but they also seem to shorten the time that you have Bell's palsy. So fish oil, your fish oil supplements are great. Another one is ginkgo biloba, increases blood flow, it promotes nerve growth. It also seems to have an antiviral activity. So ginkgo biloba, I forget the number of the podcasts that we did on ginkgo, but we talked
Mhm.
about ginkgo in the past. A good nutraceutical for helping with inflammation, but an even better one, and we've talked about this on a number of podcasts, is curcumin. It's a great one to help decrease inflammation. Um, there's some interesting studies on green tea extract, specifically the compound EGCG, and it just seems to reduce body-wide inflammation, especially related to metabolic disorders like diabetes. And in animal models, it seems to have a role in preventing a whole range of neurological disorders. I call it more of a preventive than treatment. It's not one of my go-tos that I go right away to, but it's something that can help. Vitamin E is another one that can certainly help. I usually just incorporate it in a multivitamin. Sometimes I'll go with vitamin E, in higher doses by itself. Animal research shows that the vitamin E levels are needed for an effective immune response, specifically to HSV infections. So it may play a role there. Um, Alpha lipoic acid, this is one that has also been shown to improve nerve function for really any type of neuropathy. Any type of neuropathy, alpha lipoic acid is great. I think we talked about peripheral neuropathy before, and we talked about both acetyl-L-carnitine and alpha lipoic acid in those podcasts. And we talked about as far as helping nerve function. And again, we're talking about the facial nerve for Bell's palsy, so anything that can help that. But let's talk specifically about natural ways to real quickly to mitigate any possible viral infection. Licorice being one of them. Licorice root extract, glycyrrhiza is the Latin name. I love this stuff because it has a very strong anti-inflammatory effect, but is a very strong antiviral, specifically for HSV1 and chickenpox. And so it's a really good one to do. And I even recommend it, like if you have the cold sores,
Mhm.
even with genital herpes, I'll recommend like a Q-tip and dab them on the lesions, and usually it helps take it away right away. And sometimes I'll mix into that extract like either lemon balm essential oil, which also has antiviral activity specifically against HSV1 and the other varicella zoster virus, the chickenpox virus. So that can help. And then another one is zinc. We talked about zinc quite a bit, especially with COVID. It's also an important nutrient for nerve function, but any viral infection, it does seem to inhibit replication of most viruses, or at least help inhibit replication of most viruses. And again, specifically, one of the big ones is HSV1. So this is why people who are zinc sufficient, as opposed to deficient, tend to have less outbreaks of any type of viral infection, whether it be shingles, whether it be the cold sores, whether it be Bell's palsy, anything like that. And then we talked about arginine and lysine. You want to decrease arginine in your diet. If you're taking an arginine supplement, some people are, and you have Bell's palsy, you probably want to stop. May want to think about lysine. Lysine inhibits replication of HSV infections, other viral infections, whereas arginine upregulates that. And then there's certain mushroom extracts like reishi mushroom, which has been used a lot in Chinese medicine for building up what they call the Wei Qi, or help balance in yin and yang. And what we find, it has a very strong antiviral activities against both oral herpes and genital herpes in the laboratory setting. So, and it's been shown to reduce inflammation. I think those are the main ones I want to talk to. We can go on because there's a number of other nutraceuticals that are both anti-inflammatory and may help, but I went over the main ones. And the main thing I do, just to reiterate for people, is I do recommend acupuncture, not because, I'm biased because I do acupuncture, but it is one of the main treatments that even conventional doctors see can significantly help, and it has some good science behind it. Whereas, if you're going the conventional route, usually it's like steroids and maybe an antiviral. But the acupuncture is really something that people can get on and do. And it's a very non-invasive treatment. And do you really want to do the other thing I bring up for, like, if you have like comorbidities, especially like diabetes or metabolic syndrome, do you really want to add steroids to that? No, you don't. I mean, steroids can make your diabetes worse and metabolic syndrome worse, can raise blood pressure, so on and so on. It can increase your appetite, make you eat more, mess up your blood sugar. So there are, certain people that maybe it would be good to go the conventional route, but most people I'd recommend go the natural route, try that first. But either way you go, you want to get it treated, as you stated, Brian, in the beginning, as soon as possible.
Yeah. Yeah, and as you're recovering, just in terms of, you were mentioning exercises and stuff like that, definitely want some guidance as far as like coordinating all these things, right? So like as all these muscles start to turn back on, you obviously you want your mouth, your face, your expressions. Obviously, you're worried about them being equal bilaterally, and then just making sure the muscles are coordinated in the right fashion, kind of turning them on in the right appropriate order and getting them prepared to do what they used to do.
Yeah, and that's a really good point, Brian, because the other thing I want to bring up, like, if this goes on, what happens is, what do they call it? I think they call it synesthesia or whatever, where the nerve function is not coordinated. Like,
Right.
if it keeps going, where it doesn't get coordinated. So then what can happen with some people is you can get like inadvertent muscle twitching that won't stop. You lose a little bit of control of those facial muscles because the nerves are not regenerating appropriately. So I think it speaks to what you were saying there.
Yeah, not just about what you do, but how you do it with everything.
Right. Yep.
Anything else, Keoni?
Let me see. Think I think that is it. I guess if I had to reiterate anything, I just tell people, like, really take care of your eye. Like, when you have Bell's palsy, your eye does not, you can't close your eyelid. You really need to make sure that you use the artificial tears or the ophthalmic ointments to prevent damage to the cornea, because it's very easy to damage the cornea when you can't shut your eye.
Yeah, you need to protect it in some way.
Yeah, you need to
Some
protect it in
physical
some way.
barrier.
You're right. That's very important. So, but no, I think we covered everything we wanted to cover. I don't think there's anything else I really
All right.
wanted to say.
All right. Well, until next time, everybody, be well.
Be well, everybody. Take care.